Hello, everyone, and welcome back to another episode of All in All with Alex. I'm your host, of course, Alex. Today, we have a very special guest, Dr. Brian Boyle. How you doing today, sir?
I am doing great, Alex. I'm excited to be here. Thanks so much for having me.
Oh, yeah, no problem. Did I pronounce your last name correctly? Because,
You did. You pronounced it the way I'm used to hearing it pronounced by my relatives from North Carolina. So,
okay,
so
yeah, that sounds about right,
yep,
so I'm from down south, so I
yep,
understand.
yep. Up here it's Boyle. Down there it's more of a bowl.
Yeah,
Yeah,
for sure, for sure. So, all right, so can you give the people a quick background about yourself, and then we'll dive into the questions?
absolutely. So, thanks so much again, Alex. I'm just so excited to be here and talk to you guys about an area that I'm just so passionate about, and it's always fun to have an opportunity to share what we're doing with everyone else out there. So I'm a psychiatrist, and I'm what's called an interventional psychiatrist, which means I subspecialize in the area of psychiatry that treats people who are not getting better with the conventional treatments like medication management and talk therapy. And the way we do that is by offering focused, biologically targeted in-clinic treatments like ketamine, like intranasal S-ketamine, also known as Spravato, like transcranial magnetic stimulation, also known as TMS, and like stellate ganglion block, which I could certainly talk more about, and is something that the company that I am helping to build really has tremendous expertise with. So that company is called Stella, and I'm the chief psychiatric officer of Stella. I have trained at Harvard and MGH McLean, and over the past several years, built a clinic in Boston that employs these treatments to help people get better who, like I said, aren't getting better with the traditional stuff. And last year, joined forces with Stella to create a Stella site here in Boston and take on this leadership role that I'm just so excited about to help continue to shape Stella's mission going forward, which is to help as many people as we can to improve outcomes in treatment-resistant depression, PTSI or PTSD, and anxiety disorders. So that's what we're here for. That's what we're hoping to do. Just trying to spread the good word.
Okay, I like it. I like it. So let's dive into it. Um, what was the main thing that inspired you to specialize in interventional treatments like ketamine therapy?
It's a great question. And the short answer is that I just didn't see consistent enough positive outcomes using only the traditional treatments like medications and therapy, which, to be clear, are still the mainstay of treatment. They're still critically important. And we really see our role as one of working alongside the clinicians who have long been taking care of their patients using these more conventional methods, which remain, in most cases, first line. But not everybody always gets better or gets better enough with that stuff. And we want to be here for those people. We want to be here for those clinicians who are doing their damnedest to help their patients and who don't necessarily have the tools to do so. So we see our role across all of our clinics as collaborative and as supportive. And I got into this again simply because I wasn't seeing people get better enough, consistently enough. And then I saw what was happening, especially over in the ketamine. And actually, at the time, I was a fourth year resident and I was working with a close mentor named Rob Meisner. Shout out to Rob Meisner. He runs the service over at McLean Hospital. And he invited me to join his service coming out of residency, which was a tremendous opportunity. And so got to train at McLean for several years, develop expertise in the use of ketamine, Spravato, and also got some exposure to TMS and ECT or electroconvulsive therapy as well, and built my clinic around ketamine and Spravato originally to bring this to more people. I was just seeing people having these incredible outcomes, but the wait list was building and building over at McLean. And I thought, man, we gotta get this to more people. So from the outset, have worked with insurance companies to get as much coverage for people as we can. That's a huge part of the mission as well, both at my site and at Stella more broadly. Again, access is part of what we're trying to accomplish here. But the short answer to your question is I just saw the incredible power of what these treatments could do for people.
Okay, I like it. I mean, it's there's a lot of issues, that aren't really highlighted in this world. You know what I mean? Of things that's going on with people, whether it stems from um things in their childhood or things going on now. And the kind of work that you do is definitely much needed. A lot of people will just, if conventional things don't work, they'll just say, oh, well, it just must nothing can be done. Nothing can be done. So it's definitely refreshing to find someone like you that goes that extra mile and just, until you find something that actually works for the person. So thank you for that.
It's our pleasure to do it, and it's a ton of fun helping patients get better. And we sit with them when they're not, and it's an incredible privilege to be able to do that. And so we do offer hope when often there is a lack thereof.
So how do you feel your background in philosophy influenced your approach to psychiatry?
So glad you asked that. So we're getting into that. Yeah. I really appreciate you bringing that up, Alex, because my background in humanities and in philosophy in particular is a huge part of who I am and how I think about the world, certainly patients and patient care included. And in short, I think training in philosophy keeps your mind open and it keeps your mind disciplined at the same time. It helps me identify traps in thinking, traps in logic. It helps me think on the ethical side more humanistically. It gives me different frameworks in which to think about what the right move is or what the wrong move is. And just having access to so many different models of thinking about the world, of thinking about value in the world, it helps me think about the project that we're undertaking here all the time, even if I don't realize it. That background comes into play left and right. On a more concrete level, when I'm face to face with patients, it's just training in humanism is all philosophy is. And I like to say when I got to med school and was trying to figure out what I wanted to do within medicine, I just wasn't quite feeling as though all the cylinders were firing in the different rotations that I was experiencing. Incredible work going on, amazing cutting edge stuff, but something wasn't fully there. When I got to psychiatry, I realized that it's the closest thing to applied philosophy in the world of medicine. And I often feel that day to day, what I'm doing in doing my best to connect with people, to empathize with people, to understand their stories, to be curious about their stories, is that I'm leaning on that tradition. Because in a sense, that's all philosophy is. It's that ultimate curiosity about the human condition and what we're all doing here and what we're trying to do. And so I'm glad you brought it up, and I'm happy to spend as much time on that as you want, but I think I'll leave it at that for now.
Okay. Yeah, I like it. I mean, I try to come up with, different things to touch all topics as much as possible, so that way people can really get a true understanding about who the guest is, and why they think the way they think, or why they go about things the way that they do. So let's go with this. So can you explain the concept of mentalization-based therapy and its benefits?
Absolutely. So I appreciate it, Alex. You're going back into the greatest hits, and we're focusing on things beyond just the interventional treatments that we offer, and getting into the things that really help inform the way that I think. So it feels almost indulgent because I get to expand on all these things that have helped shape my lens on this work. And mentalization-based treatment, for one thing, it's an evidence-based psychotherapy for personality disorder. That's how it was developed. And it really builds upon the tradition of attachment theory. And I won't go too deep into the kind of conceptual underpinnings of it, unless you'd like to do a deeper dive. But fundamentally, what mentalization-based treatment or therapy does is it encourages people to maintain an openness, a flexibility of mind, a curiosity to imagine what the other person in an interpersonal scenario might be experiencing that's a little different from the initial conclusion. So I'll back up a little bit and say that people with personality disorders like borderline personality disorder, narcissistic personality disorder, and others tend to struggle with a relatively rapid and rigid conclusion as to what the other person in a tough situation is thinking, is experiencing. And that rigidity, that rapidity of conclusion can make it hard to move forward, when in actuality, that other person might be experiencing a range of things. So mentalization-based therapy really encourages a person to consider and explore other possibilities as to what another person might actually be experiencing inside in that moment that's different from what that initial thought was. Similarly, turning the so-called mentalizing lens on oneself, MBT encourages people to really be curious about their own internal experience in these kinds of moments. Again, not taking for granted, not making any assumptions about what's really going on there, but creating some time and space to actually look inward or consider the other in a way that can foster much more effective communication, help people work through really difficult interpersonal scenarios. And so I think it's a hugely important and effective treatment modality. I'm speaking about it in the more general ways that have informed a lot of my other work, because really that works its way into all of the disciplines that I practice. And in truth, as much as I focus sometimes on the biological aspects of the treatments that we offer, it's the psychotherapeutic aspects, whether formal or informal, that I think really represent the special sauce, so to speak, at our clinic and at Stella's other clinics, where thankfully we're incredibly blessed to have clinicians who are similarly attuned and informed and sensitive to these kinds of approaches, if not necessarily trained in each specific discipline. It's more of a mindset, it's more of an approach. And it's one that I think really helps people feel seen, it helps them feel heard. And that's really where everything starts. Because if you can't establish that, it's hard to build upon a treatment plan and a treatment relationship. So I hope that's a start to an answer to your question. I'm happy to talk more about MBT. But in a more concrete way, before we jump on, I should also say that in the world of treatment-resistant depression, treatment-resistant PTSD, or you heard me say earlier, PTSI, so post-traumatic stress injury, which we feel is in some ways a less stigmatizing term, and anxiety disorder, we often encounter either undiagnosed or undertreated personality disorder. Happy to talk more about that. But having expertise in the realm of treating personality disorder, which can often make more complex the treatment of conditions like major depressive disorder, is really important, because you can identify the facets of someone's suffering that might respond to treatment and the facets that probably won't, and help them get the resources in play that will help them get better. So again, the spirit here is helping patients get better when other things aren't helping them. Whether that's with treatments we offer or not, we're still thinking clinicians, we're still going to think broadly, comprehensively in our initial assessments and beyond. And if we think someone needs a treatment that we don't offer, we'll say, you know what, I've got a colleague around the corner who can offer you this. And I think this is really.
Yeah, I like that. I like that. The most important thing out of all that to me is, the continuous thinking, the never giving up on a patient, because,
Absolutely.
You see too many cases where it's like people feel like they've been given up on, so it's definitely refreshing to hear, that you still have, clinicians out there that are, willing to go the extra mile.
Absolutely. That's what we do.
So, how do you feel that your work at Stella differs from your previous roles in psychiatric care?
Yeah, that's a great question, and it's interesting, Alex. It's been such a whirlwind over the last year, and an exciting whirlwind. Jumping in with Stella and now being an integral part of Stella's growth, being surrounded by these incredible colleagues at Stella, just couldn't be more thankful for people like Dr. Eugene Leapoff, co-founder of Stella, pioneer in the application of stellate ganglion blocks for treatment-resistant post-traumatic stress injury, something, again, we can talk further about. And people at each of the sites, people like Dr. Howe in Southern California. We've got offices in New York. We've got offices in DC. So we're spread around, and of course our flagship in Chicago, and partner sites around the country. Co-founders like Michael Gershenzon, Philippe Sanchez, our CEO. These are all incredible people. Shauna Springer, co-founder and chief psychologist, Karen DeCucker, VP of Clinical Services, and just an incredible clinician herself. I'm naming all these people because I think they're so important. The people are so important at Stella, and I think it's this team of people who have really helped me experience this work in a different way by being able to bounce ideas off of each other, share new thoughts, new concepts, And just not doing this in a vacuum is just incredibly eye-opening. So I'd say the people and the team-based aspect are a huge part of it. And also just the scale, right? Let's be frank. There are things that you can accomplish when you are involved in an effort that spans the entire country that is hard to accomplish when you have one clinic in one place. And so a lot of what drove my decision to become a part of this incredible organization is the opportunity to do something I had long wanted to do, which is to offer and administer these treatments across a larger organization at higher volume, which will allow us to continue to gather data rigorously, but at a higher level that we can analyze and that we can learn from and try to understand how to sequence, how to combine, how to offer or not offer each of these different treatments in sophisticated ways that really nobody else is doing. And again, you need volume to do that. You need sites, you need resources. And that's what really got me excited at the outset before I had the pleasure of meeting all these incredible people and understanding what a thoughtful and compassionate organization this is.
Yeah, I would agree. Anything that you want to do in this world, like, as we talked before, I was, talking to you about like businesses and stuff like that. Anything that you're doing, it boils down to what resources do you have? Do you have enough resources? Do you have the funding to get enough resources? Things like that. So, yeah, I definitely understand that. I mean, resources is definitely a huge part of it because you feel like your hands are tied if you don't have as much resources as you need.
Absolutely. Absolutely. I mean, Alex, you're an entrepreneur. You get it. It's an exciting and a challenging road, and becoming part of a bigger family can be a ton of fun and really open up new possibilities. So
For sure. So, what motivated you to found Measured Wellness, and then how was it evolved?
yeah, so Measured Wellness is the name of my practice before it became Stella Boston.
Oh, okay.
So Measured Wellness is the practice that I founded and which still exists, though under a different name right now. When I was working at McLean and seeing these incredible outcomes that we were getting with ketamine and S-ketamine in particular, and of course also with treatments like ECT and TMS also being something we now offer. But in terms of what I could just jump in with and get going myself, I found space in a little neighborhood called Brookline, right next to Boston. It's actually a big town, but the part of Brookline we're in is right adjacent to the city. Hung out my shingle and said, you know what, I want to help some people. Got in network with insurance companies so that I could offer intranasal S-ketamine, aka Spravato, and generate the kinds of incredible outcomes that we were seeing over at McLean. Again, McLean, incredible service, incredible place to learn and develop this expertise that now I could employ in the community. The only problem at McLean is that everyone wanted to get treated there and the wait lists were a mile long. And so I saw an opportunity just to increase access to these treatments. And that was really what spurred me on. And of course, I've got a little bit of that entrepreneurial bug and wanted to give it a try. What's it like to build my own thing? What's it like to build a team? So I'd long had an interest in things like organizational consulting and thinking about how teams work and how organizations function well or not so well. And so wanted to apply some of that thinking as well to building my own effort.
Yeah, no, I understand that. I mean, that entrepreneurial itch, it'll just get you and it'll pull you in. I mean, especially, doing something like that, being able to build your own team and, be proud of the team that you built. Because I mean, you build your team and it's just something it's something that helps make you feel good. You're like, man, I built this team. I built what we have here, and it's a whole nother, if you haven't experienced it, it's a whole other feeling. So
you get it, and it comes with its ups and downs, right?
But yes, for sure.
The highs are high, the lows can be low, and you get through it. But yeah, it's an incredible and unique experience. And at the end of the day, when I was working in this clinic at McLean and seeing people come in with depression that just was not getting better, people for whom the next trial of another antidepressant pill was probably going to have about a 5 to maybe 15% chance of working. And here we have something we could offer them that had more like a 75 to 80% chance of working. I thought, this is incredible. It ain't perfect, but it's damn good. And it's a hell of a lot better than just the next prescription drug. So that's when I thought, you know what, we gotta get this out there. We gotta help more people.
Excuse me. So, can you discuss the importance of psychodynamic approaches in modern psychiatry?
Absolutely. So again, I'm feeling this appreciation, Alex, because you're asking me about the kinds of things that I think about all the time, but actually don't have as many formal opportunities to talk about as much as I used to.
Mm-hmm.
So I've been really interested in psychodynamic therapy ever since I was a resident in psychiatry at MGH in McLean, and actually had the incredible opportunity to do a psychoanalytic fellowship at the Boston Psychoanalytic Institute. Between that and some supplementary coursework seminars that I did over there, and being the chief resident in psychotherapy training with my program, I got this incredible opportunity to get a lot of exposure and experience with therapy, which is not something that every psychiatrist gets to do, especially so early in their career. And I just feel so lucky for the mentors that I had throughout that process. Because I think what psychodynamic therapy offers in modern psychiatry, when often, and you might be implying this, it's true, when often biological treatments are the focus, when often biology seems like the next cutting edge, the next big thing. What psychodynamic perspectives offer is, again, that humanistic dimension. So at the end of the day, before you decide what you're going to do for a patient, what you're going to offer them, you have to formulate, understand, wrap your head around what is happening for them. And that will have dimensions that are both biological and psychological, in addition to social. And you may have heard in the past of something called the biopsychosocial model of formulating patients. We often think about this in psychiatry. But what that's basically saying is you've got to think about not just the possibility that this person is suffering with an illness that has a defined biological mechanism that might even come on as what feels like something of a thunderclap with a life of its own. They might also be suffering with psychological challenges that go far beyond that, that have their roots in their childhood experiences, in the structures of their families, in traumas that they've endured in their lives. And you need a framework, you need a lens through which you can look at those things and create essentially a kind of formulation that is comprehensive and thorough about what this person is going through, who they've been in the past, who they are now, and how you're going to help them. So psychodynamic theory, psychodynamic work, I think still plays a tremendous role in modern psychiatry and augments, doesn't replace, but augments and makes better any of the biological treatments that we're offering. I think we often also forget that even as we're offering treatments that are under the heading of biological, every interaction we have with a patient is, and or at least ought to be, informed by a psychodynamic frame of thinking. Because you're talking with a person. You're not talking with a set of neurotransmitters. You're not talking with, right, a set of biological processes. You're talking with a human being. So that's what I think psychodynamic therapy really offers.
Okay. I liked it. I like the way you broke that down. So, okay. So let's do so. Speaking of psychodynamics, how does your training in systems psychodynamics inform your approach to group therapy?
Great question. And I alluded to this a moment ago when I said I did some extra coursework over at the BIPSI, Boston Psychoanalytic Society and Institute, back when I was a resident. I took these incredible courses on the way in which psychodynamic theory can be applied not just to an individual, but to a group of people. And that group of people can look like a family. It can look like an organization. And at the end of the day, what you're trying to do is understand the ways in which unconscious processes are affecting human behavior in organizations. In a nutshell, that's what systems psychodynamic theory does. I think about it day to day most commonly in two ways. One is in the context of the organization that I work for, Stella. And the other is in the context of the patients that I'm treating who are part of their own organizations, whether those are families, companies, usually both, A lot of people have families, a lot of people have jobs. These are both organizations that can be thought about in this kind of way. And I think the fundamental insight of systems psychodynamic theory is that people can sometimes be induced into behavior when they're in these structures that are not merely the result of their own individual personality structure, but actually a result of their role in an organization. For example, you'll often hear, oh, that boss, oh, he's just a tyrant. Oh, he's a narcissist. Oh, he's just the worst. Or you'll hear like, oh, that person, they're just so passive. Oh, they're not being aggressive enough. Oh, they're not really seizing the day. And you might think, well, each of these people is behaving those ways because of who they are and who they are only. System psychodynamic theory says, well, actually, maybe not. There may be part of that there. It may also be that these people are behaving the way they're behaving because of the way in which the structure in which they're operating has cultivated or even asked for that behavior in a certain way, has basically forced them or made them feel that they have to behave that way, whether right or wrong. That is a really important model because it helps to take away notions of blame and shame and cultivate a more effective conversation about how groups can work better. Another core insight of this set of theories, in my opinion, and at the time I had a wonderful mentor in this space named Ed Shapiro, who's a luminary in this realm of system psychodynamic theory. And a core insight that he helped me understand as a takeaway from all this is that people will tend to behave in organizations, whether the family they build later on in life or a company they work for, will tend to play the role that they themselves played in their own families of origin growing up. So if you understand the role that someone played in their own family that they came from, you will get insight into how they're going to behave both at their job and in the family that they themselves are trying to build now, or any other group that they're a part of.
Okay, that's different. That's different. Conversations like this will make you really, and that's why going back to you doing having the not psychology, the philosophy background, thinking differently than people, thinking outside of the box, thinking abroad, things like, talking about what you're talking about, psychodynamics and things like that. It makes you think about stuff in a different way, which I feel like everybody in the world should go through some kind of similar training to that. Because I don't think people take the time to think about things in different ways a lot of times. And I think it kind of like, I need to find the right word for this. I ain't gonna say it dumbs them down, but it just kind of, it, they already say we use how much % of our brain do we use?
I think they say something ridiculously low. It's an old cliche, but
Yeah.
I wouldn't venture a guess as to the real or what the denominator of that is. I don't even know how to measure it, but yeah.
But I
The
mean,
point of
even
the
if we
matter
only
is, I think you're absolutely right. Yes.
even if we only use 75% of our brain, but on a daily basis, but someone like, for yourself per se, we'll say you probably use, they just say 90%. So if everybody else is using 75 and you're using 90, if we had everybody to that level, I feel like it'll do a lot of positive changes for the world. Let's put it like that.
Well, that's a kind thing you've said to me there, Alex. I'm not so sure I'm using any more of my brain, but maybe I'm just at any given moment able to try different parts of it, and I've got more on the menu, so to speak. And I think whether or not that's so, that's what I feel that these different frameworks offer me, and I'm really grateful for that. It's just different ways to think about things. And I think there's a real overlap and kind of dovetailing of all that we're talking about here in terms of psychodynamic theory, system psychodynamic theory, mentalization-based treatment, and things like ketamine treatment, S-ketamine treatment, stellate ganglion block, TMS. Because what we think all of these things are hopefully doing on some level is generating a kind of flexibility, a kind of malleability of mind, a kind of getting unstuck process that really is common to all of these things. Because when someone's really suffering in the trenches of depression, anxiety disorder, post-traumatic stress injury, they're stuck in well-worn grooves of thought and of feeling that they're having a hard time getting themselves out of. And so whether it's with words and empathic presence, or the administration of one of these focused, targeted biological therapies, or ideally, both in an integrated way, which is what we hope to offer at Stella. Ultimately, what we're doing is helping get people unstuck and moving forward.
I like it. I like it. So let's go with okay. So, what adversity or challenges have you faced in implementing innovative treatments in traditional psychiatric settings?
Great question. And the short answer is it's been a challenge or a set of challenges of education, because these are often treatments that are not as familiar to the people to whom we're offering and describing them. And I mean often not just potential patients, but referring clinicians, psychiatrists, psychologists, psychiatric nurse practitioners, primary care physicians, whoever might be initially the first line person encountering someone with a treatment-resistant psychiatric condition. They don't necessarily know about any of this stuff. They may have heard some things through the grapevine. There may even be some stigma, some fear around what these treatments can do and the risks involved. So a lot of what I do is educate. Just talk. Just share what we're doing, how it works, what the potential benefits are, what the potential risks are, and just let people gain a sense of understanding and, in some cases, even a sense of ownership of the process with us. Again, we want to bring people in, not separate, not divorce. So our role here is not to come in and reject traditional psychiatry. I say that very clearly because I think in some pockets of the psychedelic psychiatric realm, there can be a little bit of an anti-psychiatry notion, almost like let's get rid of all this old stuff. This ain't working. That's not the perspective from which we're coming. Our perspective is more additive, augmenting, synergizing with, integrating with, collaborative, right? This is what we're trying to accomplish. So if you're trying to accomplish that, you've just got to teach people. People just want to help their patients get better. Patients just want to get better. And so it's all about education. And ultimately, people are usually open-minded. So if you give them a chance and just talk to them, you can usually work through this stuff.
Yeah. Yeah, and I mean, I like the fact that, you're coming in saying, hey, I'm not trying to say your methods don't work. I'm just saying that I have other things that can help with your methods to help ultimately make the patient, get the patient where they need to be, basically.
Exactly. Couldn't have said it better.
Okay. I like that. Okay. So what do you see the future of what do you see the future of psychiatry evolving with the integration of new technology?
That's such an exciting thing to think about. And ultimately, I think we've got really exciting things happening in a few different realms. So on the one hand, we've got technology in the form of telepsychiatry platforms that are helping increase access to care more broadly. We're super excited to be partnered with Cerebral, which is a company that offers these treatments, medication management, therapy on remote platforms and often under insurance coverage in a way that just increases access to those things for more people. So that's where it all starts. Let's not necessarily jump straight to the kinds of treatments that we offer here at Stella. In terms of the broader project of the next generation of psychiatry, let's just get more people access to psychiatric care. Fantastic. And then you've got the piece, which is the incredible set of innovations in the biological therapies themselves. We're incredibly excited to be working with agents like ketamine and esketamine, with technologies like transcranial magnetic stimulation, with stellate ganglion block. These are all technological or biotechnological advancements of the last, really, couple of decades in terms of their maturity. Okay. Beyond that, though, there's more in the pipeline. We've got things like psilocybin, which is very promising in a lot of ways. We've got things like MDMA being considered for different new applications. like depression, like post-traumatic stress injury. And I won't list more and more, but there are more molecules in the pipeline. There are more technologies in the pipeline. And so let's just call that the biological treatment set of options is going to get broader and broader. So we're just excited to add those things to our armamentarium as soon as they are ready, as soon as there's an evidence base to suggest that they're safe and effective, which is a core tenet of what we're all about.
Right.
We want to be at the cutting edge, but not beyond it.
Yeah.
That's the sweet spot. So you've got that set of things. And I'd say also another bucket around evolving attitudes actually toward psychodynamic theory, toward psychotherapy in general. I think it's interesting, Alex, if you just talk in really broad strokes, back in the day, there was psychoanalytic theory. And then there was the biological revolution in psychiatry in the 80s, 90s. And all of a sudden, it was all about drugs. Since then, I think we've tried to find a kind of balance between those things, realizing that neither frame of thinking is going to be the magic solution, the panacea. We've got to think broadly. We've got to think openly. And so I'm seeing also exciting ways in which psychotherapy is being integrated into care, whether it's augmenting a ketamine treatment, whether it's new actual modalities of therapy that are helping to treat people in ways that we simply haven't been able to before. Very exciting stuff. So psychotherapeutically, biologically, and technologically in terms of access, I think we're going to see an exciting next generation of psychiatry.
Okay. I like it. So, switching it up a little bit. Let's do. Let me do this. What aspect of psychiatry do you just absolutely love the most?
Just sitting with patients. It's my favorite thing.
Well, outside of the patient. So as far as like, I guess I should say, what form of therapy, what form of, is it dialectical behavior therapy? Is it but basically, those type of approaches. What is your favorite approach? I guess.
Alex, it's a great question, and I'm going to have a hard time answering it because, as I said, my favorite thing, and I said it reflexively, is just the incredible privilege of being in the room with a patient, having that person feel as though they can really open up and share their experience with me, and being in a position to try to understand as best I can what they're going through and employ whatever treatment modality I can to help them. So it's that interaction that just immediately came to mind when you asked me what my favorite thing was, because I have to pull from all of these different disciplines that I've trained in or practiced before. And it's an integrative kind of process.
Okay.
So I realize that's not an incredibly satisfying answer, but that's the truth. That's the truth. And I'm also going to try to answer maybe the spirit of your question more honestly. At the end of the day, as much as I enjoy being able to offer all of these biological treatments, as much as I enjoy every modality of treatment, frankly, it's the psychodynamic understanding of patients that I think enriches that whole process. These other things are all interwoven into it. But the psychodynamic theory, in a lot of ways, I think is actually the trunk and branches, and the leaves of these treatment possibilities grow out from that. And so if I had to answer the spirit of your question and not sound like a politician or something trying to dodge it, I think if you want the nitty-gritty truth, it's that way of formulating what patients are going through and then teaching it back to them, because it goes back to the origin of the word doctor. We're teachers. Ultimately, we're doing our jobs really well if we end up making ourselves obsolete. So if we're teaching our patients how to use the frameworks and tools that we ourselves are employing in understanding what they're going through, ultimately, they won't need us, or they won't need us as much. And that's a beautiful thing if people can move to that stage of treatment and not necessarily just need more and more treatment, but less and less over time because they're doing great. So we always want to be there for them, but that's really the goal. And I think in a lot of ways, without the psychodynamic training and the psychodynamic underpinning, I would feel a bit at a loss when a patient walks into the room. Whereas now I feel like I've got a framework on which to place this set of other things.
Okay. I like it. And when I was just thinking, when I asked you like which way did you like the best, and then you said something that made me think of something. And I was like, you know what, that would be like a nice slogan for him. So I was like, when you said at the end of the day, I thought about it. I was like, okay, he's doing it different. So I say, at the end of the day, do it the Boyle way.
At the end of the day, do it the Boyle way. I like that. Yeah. I like that.
That's a new slogan for you right there. There you
go.
go.
Put it on the website. That's
go
awesome.
for it. I don't want anything from it. Just go for it. I like it.
I'm going to credit you, Alex. I'm going to credit you. I'm not going to take it.
Hey, just embed this episode of the podcast on your.
There we go. I like it. That's great.
But yeah, I definitely like it. I mean, and back to it, you weren't dodging the question. I like, how it's always about patients first. You know what I mean?
What it's
because
all about.
We've seen different things in the world that goes on, but for you to be patient-centric, is a big key for a lot of people. So I definitely like it, and I'm glad we have people out here like yourself and your company doing the things that you guys do.
Well, it's our pleasure to do it, and I really mean that. It's an incredible privilege.
Yes.
I mean, the way in which patients come to us and open up to us, that's a real responsibility and a real privilege to sit with that, to hear them, to even have a chance to try to understand them and how we can help them better. So it's a lot of fun, and at times it's really challenging, and at every point we're there, and that's the most important thing. Whether we achieve the great outcome immediately or a little down the line, or even if we fall a bit short of what we're trying to accomplish, but get people the other resources in play that they need, the most important part is that we're an empathic presence for these people. That's it. Mm-hmm. Because regardless of the outcome, that's making a difference for people who often don't feel like they have hope, who feel like there's nothing left to try, and who often don't feel like they have the support that they need. So at the very least, we can be there, we can be listening, and we can hold space for what these folks are going through. And that's an incredible privilege.
All right. So I got about 2 more questions for you before we wrap things up. One is why what was there a meaning behind the name Stella?
Yes. So it comes from that procedure, stellate ganglion block, which the company was actually founded around by co-founders, including Dr. Eugene Leapoff, whom I mentioned earlier, who is a luminary in this space. And he pioneered, along with a few other folks around the country, but he's one of the earlier pioneers of the application of this localized, focused, ultrasound-guided nerve block to the treatment of post-traumatic stress injuries. So essentially, it's the use of ultrasound to locate and guide the placement of a small amount of anesthetic near a bundle of nerves in the neck that's part of what's called the sympathetic nervous system that essentially mediates the fight or flight response that characterizes a lot of the suffering that happens in post-traumatic stress injury. And what this treatment can do is rapidly and profoundly dial down the amount of those symptoms that people are experiencing. It can be absolutely incredible how quickly this can work. And so really the company was founded around that stellate ganglion block, Stella. And as the company grew and came to take on other service lines, other treatment possibilities for people, things like ketamine, now S-ketamine and TMS, now we've got a full tetrad, a full 4 different treatments that we can offer. And that's really exciting because it keeps us from ever being a hammer looking for a nail. When you only have one thing to offer, it can sort of start to feel like everyone might be a candidate for that. And that's a trap that we would never want to fall into.
Right.
So again, whether it's with us or outside of our walls, we want to help patients get better. And that's what we're here for.
Mm-hmm. I like it. So, well, actually, Yeah. So the last question before I do something else is going to be, uh, do you have are you an author? Have you written any books? Because you seem like you would probably have written a couple books by now.
Well, I appreciate that, Alex. That's a compliment. And now I feel remiss saying that I actually haven't written any books in psychiatry. If you want to hear a funny little tidbit, it's that I actually have written a book, but it was when I was working for an orthopedic surgeon between college and medical school.
Okay.
Wonderful surgeon named Bob Marks down in Manhattan at Hospital for Special Surgery. And I co-wrote with him a book on ACL injury prevention and repair.
Okay.
And that's actually the only book I've ever written. I've written some other things and currently working on a paper with my colleagues at McLean looking at outcomes with Spravato and intravenous ketamine treatments. So something to keep an eye out for. That's in process.
Okay.
But I appreciate that. And maybe you and I should collaborate on something.
I was thinking that while we were having a conversation because actually, just a quick little thing about me. Actually, when I was I say when I was growing up. So originally, when I was growing up, I wanted to be a lawyer. So then I got a little bit older, and in the last, I would say 5 to 6 years or so, I've really been thinking like, man, people come to me a lot because of my way of thinking and the type of advice that I give and the way I go about looking at things. And I was like, I kind of want to be able to they call it a shrink, but kind of be like a psychiatrist to be able to help people, talk people through their problems and find the root of things. Like, I feel like I got a good knack for that. Of course, I know it will take certain schooling or whatever, but I don't know. I piqued the interest in it. So,
Alex, absolutely. Just the way you ask questions, the way you've asked great questions, questions that have really obviously gotten me talking, right? Gotten me excited to share. That's the core. So if that's something you want to pursue, I would completely encourage you to do that.
okay. Yeah, and we'll talk more after the episode, or we'll talk more to see what we can collaborate on as well. So, but before we get up out of here, is there anything in particular that you would like to share with the listeners that we haven't touched on so far?
I would be remiss if I did not say that I'm just so thrilled to be part of Stella. And for anyone out there who is interested in what we might be able to offer, either for themselves, for a friend, for a family member, for anyone in their lives, stellacenter.com. Go take a visit. And if you're in the Boston area, I'm over in Brookline, 1180 Beacon Street. Come see us. We'd be happy to help.
Okay, perfect. That works. So, everybody, if you guys would like to see everything that Dr. Brian has in store, I'll put all the links for any of his websites, social media, things like that, and the show notes on the audio version and in the description on the video version. So you guys go support him in every way possible because good people need support. So. But yeah, once again, Doctor, I thank you for your time. I appreciate you coming on the show today and talking, giving the listeners something to hear. And, like I said, I just appreciate you.
I really appreciate you, Alex. Thank you for saying all that. It's been a pleasure talking with you. I really mean it. Thank you for having me.
Yes, sir. Same here. So everybody watching, thank you guys once again. And you guys have just watched another episode of All in All with Alex. And we'll see you guys on the next episode. Peace.
Take care.